In a world where chronic disease dominates the headlines, heart disease, diabetes, obesity, there lies a hidden thread connecting them all. It's called metabolic syndrome, a condition so common that it affects more than 1/3 of adults in the United States alone. And yet, most people don't even know they have it. Metabolic syndrome isn't one disease. It's a metabolic malfunction of the modern world, a constellation of physiological breakdowns that begin quietly, deep within our cells. Before we get too deep into this topic, hit that like button and subscribe to the channel. This will help bring the truth about health and healing to the thousands of people who need to hear this message. Now back to the episode. At its core, metabolic syndrome is a cluster of metabolic abnormalities: insulin resistance, elevated triglycerides, hypertension, low HDL cholesterol, and increased visceral fat. It's not just about weight gain, it's about how our cells respond, or fail to respond, to insulin, the master hormone of energy regulation. When we eat a diet dominated by refined carbohydrates and processed fats, insulin levels remain chronically high. Over time, our cells become numb to its signal, a condition known as insulin resistance. The pancreas compensates by producing more insulin, flooding the bloodstream in a desperate attempt to maintain balance. But insulin resistance doesn't stay silent. It disrupts the body's lipid metabolism, causing triglycerides to rise. It promotes fat storage in the liver, leading to non-alcoholic fatty liver disease, NAFLD. It inflames the blood vessels, setting the stage for hypertension and cardiovascular damage. In essence, metabolic syndrome is the slow collapse of the body's ability to handle energy. The cost of metabolic syndrome is staggering, both in human lives and in dollars. According to the American Diabetes Association, diabetes alone costs the U.S. over $327 billion annually. And that's just one facet of the syndrome. When you add cardiovascular disease, fatty liver, and obesity-related conditions, the total rises to over $600 billion per year in direct medical costs. Beyond numbers, metabolic syndrome erodes quality of life. Fatigue, brain fog, chronic inflammation, poor sleep, and accelerated aging, all are its downstream effects. But this epidemic didn't appear overnight. It's a reflection of decades of misguided dietary guidelines, a sedentary lifestyle, and a food industry designed for profit, not health. Metabolic syndrome doesn't exist in isolation. It acts as a syndromic hub, a root system feeding multiple chronic diseases. Type 2, diabetes, the end stage of insulin resistance, where glucose regulation collapses. Cardiovascular disease, driven by chronic inflammation, oxidative stress, and endothelial dysfunction. Non-alcoholic fatty liver disease, NAFLD, fat accumulation in the liver without alcohol involvement, a silent epidemic linked to insulin overload. Polycystic ovary syndrome, PCOS. In women, high insulin levels drive ovarian dysfunction and hormonal imbalance. Cognitive decline. Insulin resistance doesn't stop at the liver or muscles. It affects the brain, leading some researchers to call Alzheimer's type 3 diabetes. The deeper we look, the more we see that metabolic dysfunction is the common denominator of modern chronic illness. Diagnosing metabolic syndrome requires more than a simple physical exam. The most revealing insights come from blood work and imaging. Let's break down the key markers. Fasting insulin. Elevated fasting insulin greater than 6 micro-international units per milliliter often appears years before glucose levels rise, making it one of the earliest signs of insulin resistance. Triglycerides. High triglycerides greater than 100 milligrams per deciliter indicate poor fat metabolism and insulin dysregulation. Hemoglobin A, 1C, HbA1c. This test measures average blood glucose over 3 months. Levels above 5.6% suggest early glycemic instability. Comprehensive Metabolic Panel, CMP. Elevated liver enzymes, particularly ALT and AST, point toward NAFLD. an organ crying for metabolic relief, and beyond blood work, advanced imaging like MRI of the abdomen can quantify visceral fat, the metabolically active fat that surrounds internal organs and drives inflammation. These diagnostics reveal the invisible, a body overloaded with energy it cannot process efficiently. Here's the empowering truth. Metabolic syndrome is not destiny. It can be reversed through targeted lifestyle interventions that restore metabolic flexibility and mitochondrial efficiency. 1. The ketogenic diet. By drastically reducing carbohydrate intake, the ketogenic diet lowers insulin levels and shifts the body from glucose dependency to fat oxidation. Ketone bodies, produced in this state, serve as clean fuel for the brain and muscles, reducing oxidative stress and inflammation. Clinical studies show that ketogenic and low-carb diets improve insulin sensitivity, lower triglycerides, reverse fatty liver, and promote fat loss, particularly visceral fat. 2. Resistance and HIIT training. Exercise is medicine, and resistance training is its most potent form. Building lean muscle mass increases insulin receptor density and mitochondrial activity, helping the body burn glucose efficiently. High-intensity interval training, HIIT, complements this by activating fast-twitch muscle fibers and triggering hormonal cascades, growth hormone, testosterone, and adiponectin that enhance fat burning and repair. 3. Restoring circadian health. Sleep and light exposure regulate cortisol, leptin, and ghrelin, hormones intimately linked to metabolism. A misaligned circadian rhythm promotes insulin resistance and late-night cravings. Reconnecting to natural light cycles and consistent sleep patterns helps reset the metabolic clock. True healing requires more than medication. It demands participation. A patient must become an active co-creator in their care. No physician, diet plan, or supplement can substitute for personal accountability. Metabolic health transforms when the patient takes ownership, when they track progress, adjust habits, and stay consistent long after symptoms subside. Healing isn't passive. It's a dynamic relationship between the mind, body, and environment. Metabolic syndrome may be the defining medical challenge of our time, but it's also the greatest opportunity because it's reversible, preventable, and profoundly within our control. By understanding the science, measuring the right biomarkers, and embracing nutrition and movement as medicine, we reclaim the power that modern living has taken away. Your metabolism isn't broken, it's waiting to be reset. And the moment you take that first step, you begin to rewrite the story of your health. If you found this information helpful, please like this video and subscribe to the channel. Leave me a comment as to how metabolic syndrome may be affecting you. For more information about our clinic, please go to drvictoriamunoz.com or see link in description below. We have helped thousands of people regain their health and vitality, and we can help you. Join us next time for another deep dive into the complex world of medical science.